Infection. Tetanus. Nature of tetanus. It is acute specific infection caused by Clostridium tetani or tetani. The organism is gram-positive anaerobic bacillus with a terminal spore drumstick appearance, releasing a neurotoxin. The organism is naturally present in the intestine of horses and donkeys. The spores of the organism are present in the soil and street dirt. The spores are resistant to dryness, heat, antiseptics, and boiling for 5 minutes. Ports of infection. Soil contaminated wounds in anaerobic hypoxic tissues, puncture wounds, grossly devitalized wounds, foreign bodies. Through the umbilical stump on the presence of contaminated dressings or powders, tetanus neonatal. Contaminated catgut with the organism may also be a cause of infection. Predisposing factors: low oxygen tension, choked patients, tight bandages, the presence of foreign bodies, association of pyrogenic infection, consuming local oxygen and converting the environment to be an anaerobic one, which is suitable for growth of the organism. May also follow small abrasions. Pathology. Locally produced exotoxin reaches the bloodstream, reaches the CNS, motor nerves, or both, fixed to the motor cells, not detected in blood or CSF. The exotoxin leads to increased excitability of the motor cells of the medulla oblongata and spinal cord, leading to violent spasms on the slightest stimuli. The specific antitoxin neutralizes the exotoxin before its fixation to the nerve cells. Death occurs due to exhaustion, hyperpyrexia, heart failure, asphyxia, and pneumonia. The incubation period: 24 hours to 15 days in non-immunized persons, 11 days to several weeks or months in immunized persons. Maybe some vague symptoms: rigidity, tenderness, local swelling of the wound area. The tonic manifestations in the incubation period: rigidity, neck rigidity and extension, tenderness, local swelling of the wound area, local twitches, restlessness, a restless baby with arched back, and anxiety. The tonic stage: pain and tingling at the wound area. This is the first symptom. Trismus, lockjaw, Motor disturbance of the trigeminal nerve, especially spasm of the masticatory muscles, leading to difficulty in opening of the mouth. Facial muscles spasm, risus sardonicus in Latin, or wicked or bitter smile in English. Neck stiffness in extension, difficulty on swallowing, laryngospasm, the vocal cords are spastic, spasm of the vocal cords, hesitancy of micturition, the clonic stage, not colonic, clonic stage, reflects paroxysms of violent muscular contractions on top of the manifestations of the tonic stage. Reflects paroxysms of violent muscular contractions. The paroxysms are triggered by any stimulus like bright light with incomplete relaxation between the attacks because of the presence of the tonic manifestations. Maybe arching back of the body during the attacks. It is called opisthotonus. This is the shape of the opisthotonus. Then shows more attacks frequency and more muscle group affection. May lead to apnea on affection of the respiratory muscles. Normal or slightly raised temperature. Profuse sweating. The attacks vary in severity. Some are mild. Marked tachycardia is a grave sign. Special types of tetanus, chronic tetanus, local tetanus, cephalic tetanus, splanchnic tetanus, or cryptogenic tetanus. The chronic tetanus, the incubation period more than 2 weeks, less much severe symptoms, no reflex spasms. The prognosis is favorable. The local tetanus occurs in immunized persons. Immunity counteracts the general toxemia but fails to counteract the local toxin absorption. The spasms are restricted to the muscles near the wound. Cephalic tetanus, rare, may follow facial wounds. The edematous facial nerve is compressed within the bony canal, leading to either facial paresis or facial paralysis. Splanchnic tetanus affects the muscles of deglutition and respiration and leads to dysphagia and fetal dyspnea. Cryptogenic tetanus is a mild form. There might be no overt wound at all. Laboratory investigations may be polymorph nuclear leukocytosis. Differential diagnosis differentiated from trismus, meningitis, strychnine poisoning, tetany, and rabies. Trismus, we search for impacted tooth or temporomandibular joint arthritis. Meningitis, there is neck stiffness. The CSF is turbid and contains leukocytes and organisms. Strychnine poisoning starts in the extremities and it is entirely colonic and complete relaxation between the attacks. Tetany mainly affects the hands and the feet, positive sign, and low serum calcium. Rabies, History of an animal bite. Hydrophobia affects the muscles of deglutition and respiration. Prophylaxis. Children immunization with tetanus toxoid plus booster dose every 7 to 10 years. Immunized persons for 3 or more doses, the, the last within 10 years, are given half a milli of intramuscular toxoid on exposure to suspected spores. Immunized persons for less than 3 times are given toxoid for clean minor wounds, tetanus toxoid plus tetanus immunoglobulin, TIG, for other types of wounds. Non-immunized persons with clean minor wounds are given half a milli of toxoid plus 2 further injections every 4 to 6 weeks. Non-immunized persons with suspected wounds are given half milli of toxoid plus 250 units of tetanus immunoglobulin using another syringe in a different site of injection. Antibiotics are administered, then complete the toxoid immunization series. Treatment. Neutralization of the toxin with 3,000 to 6,000 units of tetanus immunoglobulin uh, intramuscularly proximal or at the wound vicinity. Excision and debridement of the suspected wounds, and the wounds should be left open with application of hydrogen peroxide solution to counteract the anaerobic media. Patient isolation, respiratory support, tracheostomy is done for the indicated conditions. Penicillin G, 10 to 40 million units per day, and proper nursing. Prognosis. 30 to 60% death rate in established cases with respiratory insufficiency. The death rate is inversely proportionate to the length of the incubation period. High death rate with short incubation period and low death rate with long incubation period. Also, the death rate is directly proportionate to the severity of symptoms. High death rate with severe symptoms and low death rate with mild symptoms. No lifelong immunity for previously diseased persons. The recovered patients need active immunization. Good luck and best wishes.